Infant CPR is for infants under the age of 1. The CPR cycle is the same for adult and pediatric victims. Start with C, 30 compressions. Then A, open the airway. Then B, give 2 rescue breaths. Start with C, compressions. Compressions for an infant should be at least 1/3 of the anterior-posterior diameter of the chest, which equates to 1.5 inches in most infants. Make sure the baby is on a firm surface like a table or floor. Do not try to hold the baby while doing CPR. Place 2 fingers vertically in the middle of the chest, in the middle of the breastbone. Compressions should be at least 1.5 inches in depth. Push hard, push fast. Push to the rhythm of the song, Staying Alive. Always allow the chest to recoil after each compression. Perform 30 compressions. A is for airway. Using the head tilt chin lift, position the infant's head in a neutral position, or sniffing position. Do not hyperextend the neck back on an infant. Place your palm on the victim's forehead and your fingertips under the point of the chin. B is for breaths. Cover the baby's mouth and nose with your mouth. Use only the air that fills your cheeks to deliver gentle puffs of air. Maintaining the neutral position, watch for the chest to fall as the air comes out. Take another puff of air into your cheeks and blow into the victim's mouth and nose once more to give a total of 2 effective rescue breaths. Return to chest compressions if the breaths are unsuccessful. Follow the pediatric CPR AED algorithm. Approach the victim, assess the scene, call 911, initiate the CPR sequence, and check for the arrival of an AED. When you see an infant collapse, call out for help. Make sure the scene is safe to approach. When someone arrives, point to them and have them call 911 and get an AED. Remember to use personal protection equipment. Tap the baby's foot and try to verbally awaken them. If the victim is not breathing or is not breathing normally, start CPR. Use the mnemonic CAB, which starts with 30 chest compressions. Continue this cycle until you are too exhausted to continue, the victim shows signs of responsiveness, an AED arrives, qualified help takes over. Anytime, if you feel uncomfortable with rescue breathing, perform chest compressions only. There is enough oxygen in the body for the chest compressions to be effective.